Blood sugar is the amount of glucose in your blood. Glucose is a type of sugar that your body uses for energy. Keeping your blood sugar within a healthy range is crucial for your overall health. High blood sugar, if left unchecked, can lead to serious health problems like heart disease, vision problems, and kidney disease. Monitoring your blood sugar at home helps you understand how your body responds to food and exercise. It allows you to make informed decisions about your diet and lifestyle. Knowing your numbers empowers you to take control of your health and potentially prevent long-term complications. Regular monitoring is particularly important for individuals with pre-diabetes or diabetes. It helps them track their progress, adjust medication dosages as needed, and prevent dangerous spikes or drops in blood sugar levels. By keeping a close eye on your blood sugar, you're taking a proactive approach to managing your well-being and living a longer, healthier life. Monitoring your blood sugar at home is easy with the right tools. You'll need a few essential items: a blood glucose meter, which is a small portable device that measures the amount of glucose in your blood. It's the heart of your home monitoring system. Test strips. These thin strips are inserted into the meter and hold a small drop of your blood. Each strip is for single use only. A lancet, this tiny needle, pricks your finger to get a blood sample. Lancets are also designed for single use. And a lancet device, this spring-loaded device holds the lancet and makes pricking your finger easier and more comfortable. You can find these supplies at most pharmacies. Your doctor can recommend the best meter and lancets for you. They can also help you learn how to use your equipment properly. Checking your blood sugar is a simple process. Follow these easy steps. First, wash your hands thoroughly with soap and warm water. Dry them completely. This helps prevent infection. Next, insert a test strip into your meter. The meter will usually turn on automatically. Then, prepare the lancet device with a new lancet. Twist off the protective cap and dispose of it properly. Prick the side of your fingertip with the lancet device. It's best to use a different finger each time. Gently squeeze your finger to get a small drop of blood. Touch the test strip to the drop of blood. The meter will draw the blood into the strip. Wait a few seconds for the meter to display your blood sugar reading. This usually takes about 5 to 10 seconds. Record your reading in a logbook or on a blood sugar tracking app. This helps you and your doctor monitor your progress over time. Dispose of the used lancet and test strip in a designated sharps container. Getting accurate blood sugar readings is essential for effective diabetes management. Always wash your hands before testing. This helps prevent contamination and inaccurate results. Use a new lancet and test strip every time. Reusing these supplies can lead to infections and inaccurate readings. Don't squeeze your finger too hard. This can dilute the blood sample with tissue fluid, affecting the accuracy of your reading. Store your test strips properly. Keep them in a cool, dry place as instructed on the container. Exposure to heat, moisture, or light can damage the strips. Calibrate your meter regularly. Follow the manufacturer's instructions on how to calibrate your meter to ensure accurate readings. By following these tips, you can be confident that you are getting the most accurate information about your blood sugar levels. Once you've taken your blood sugar reading, it's important to understand what the numbers mean. Your doctor will provide you with a target range for your blood sugar levels. This range will vary depending on factors like your age, overall health, and type of diabetes. In general, a fasting blood sugar level of below 100 milligrams per deciliter or 5.6 millimoles per liter is considered normal. Between 100 and 125 milligrams per deciliter or 5.6 to 6.9 millimoles per liter indicates pre-diabetes. 126 milligrams per deciliter or 7 millimoles per liter or higher on 2 separate tests indicates diabetes. It's also important to track your blood sugar levels after meals. This gives you a better understanding of how your body responds to food. Your doctor can help you interpret your readings and make necessary adjustments to your diet or medication. Regularly monitoring your blood sugar at home is an empowering tool for managing your health. By understanding your blood sugar numbers, you can make informed decisions about your diet, exercise, and overall lifestyle. This can help you keep your blood sugar levels in a healthy range, reduce your risk of diabetes complications, and feel your best and live a healthier life. Remember, knowledge is power. The more you know about your body and how it responds to different factors, the better equipped you are to take control of your health and well-being. If you have any questions or concerns about managing your blood sugar levels, don't hesitate to reach out to your doctor or a qualified healthcare professional for guidance and support.